Hi, how are you? Thank you for having me today. Uh, yeah, it's quite difficult to pronounce my name. My name is. You can just call me Kim. Yeah, that's an easy way. Alright. My name. I'm a registered nurse from South Korea, and I have 4 years of nursing experiences, mainly in medical, surgical, and oncology nursing. Especially I have care for patients with gastric and gynecology cancers. That's why I have a strong ability such as pre-post-operative care, chemotherapy, blood transfusion, pain management, symptom management, and end-of-life care. I also have interesting experience. I lived and studied in Ireland for about 3 years, and where I met people from many different cultural backgrounds. I would say I'm really quick learner, adaptable, and I have strong confidence in providing safe patient care. As I said, I care for patients with gastric and gynecological cancers. There are few chemotherapy agents such as 5-FU, cisplatin, carboplatin, Camtobel, Avastin, so on. Yeah. Yes, I have. Febrile neutropenia is quite emergency situations. I'll take it very seriously because it could be progress to sepsis or septic shock. Firstly, I will assess the patient vital sign, especially any spike temperature or like spike heart rate and so on. And then need to take the required blood test or cultures and administer IV fluid and antibiotics according to doctor's orders. Definitely, I need to closely monitor the patient for any sign of like infection. Yeah, many times. Usually my patient have with central lines, especially after surgery, because they are needed TP and IV fluid, chemotherapy or blood transfusion after surgery. But this is for the short period. That's why I need to also closely monitor any infection signs, such as redness, swelling, pain, or discharge. Yes, I have experience administering blood products such as PEC-RBCs, platelet, and FFP. Honestly, my main experience is in oncology. Uh, However, I have cared for patients with hematological issues related to cancer treatment, such as anemia, thrombocytopenia, and neutropenia, because they are needed like with blood transfusions, like after chemotherapy, depends on results. It was usually around one nurse to 13 patients, depending on the shift. Yeah, but yeah, we have nursing assistant, but it wasn't helpful too much. Yeah, it was hectic. Antibiotics. Yeah, I'm trying to. I need to check firstly any allergies before administering antibiotics, and while administering antibiotics, need to check like firstly giving slowly, then if there are like no any adverse effects, and I can give like for 30 minutes. Sorry? Ah, sorry. Alright, okay. Firstly, I need to check patient allergies, and also when administering on new antibiotics, I need to monitor patient for any adverse reactions, and also providing antibiotics slowly, like for first minutes. Then I would say like giving like at least for 30 minutes. Yes, definitely. I'm really comfortable using electric medical record, EMR, and any new medical equipment. Because I'm really quick learner, and yeah, make sure I understand the correct procedure and follow the hospital policy. Yeah. That's no problem. Yeah. That's okay. Yeah. I'm willing to do it. Yeah. No problem over time. All right. Thank you for the letting me know. Yeah. I was wondering about the ratio between nurses patient, but you already told me, so I'm good. Yeah. Thank you so much. Thank you for your time. Thank you. Bye bye. Bye 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 bye.